Okay, welcome back, Lions, to another episode of the Raw Knowledge Podcast with your host, as ever, myself, Alex Connor. And I'm back with another fantastic guest, Dr. Stu McGill. He's got a fantastic mustache and he's got a lot of great knowledge to share. I know the Australians, Stu, are really going to be admiring that one. I don't know if you're aware, but that is a very, very high trademark of a true blue Australian.
Do you know the secret to a good mustache, Alex?
Go on. I might need some tips because I'm going with the Jason Statham facial hair at the minute.
Well, it's a bit late, but the secret is choose your mother.
What is it now with the genetics? And you've got the gym very appropriate in the background. You can't pick your parents, but if you could, wow, there we go.
Yeah.
Before we dive into some really key concepts, and I know this is going to leave people on the edge of their seat, give us a very quick synopsis of, who you are, what you do, and why for people who may not know. And there's a few clues in the background.
Well, if I'm on an airplane and I sit down beside someone, so I'm going to be their hostage for the next 5 or 6 hours, and they ask me, what do you do? I say, I'm a plumber. And then I know enough about plumbing that I can get by. But I was a professor of spine biomechanics for over 30 years at the university. We created our 6 pillars of evidence, so to speak, of investigation, probing the spine system and why some people break to pain and what creates fabulous performance in some of the elite athletes and that kind of thing. And then we started a research clinic, an experimental clinic. And I set aside 2 hours to see patients. And my medical colleagues would say, what do you do for 2 hours with a back pain patient? But after the first year, we moved that to 3 hours. So that was a very different mindset. We started out simply by inviting the client or the patient to tell us your story. And we would find out all kinds of things like why they kept failing. What were the impediments that caused them to not succeed with other people's approaches? And then we developed and performed a very thorough assessment that would deal with this notion that people have non-specific back pain. In our world, there's no such thing. The assessment shows with precision what the mechanism of their pain is. That forms a roadmap for us to wind down the cause, allow them to desensitize, and then we build them back again strategically to create a linkage, which is their body, that performs well without stress and avoiding back pain.
Beautiful. Wonderfully summarized. And I'm going to make an assumption that you would tell people that you were a plumber, because if you told people what you actually did, you would get harassed for the rest of the flight with questions.
I have to listen about their mother's back pain, their brother's back pain, their own back pain. It's awful for the next 6 hours.
And a lot of people don't want to do anything about it, right?
I don't know about that. I think once a person learns a little bit in that they are actually in control of their pain, their whole psychology changes. Now, that is personality type dependent, of course, but it's amazing the number of patients who I will explain to them with quite a bit of detail why they have back pain. And they'll say, thank you. You're the first person who hasn't treated us like a 5-year-old.
That's a really salient point, actually, Stu, because I think it's the preface and the context that comes with the knowledge, which oftentimes leads into a better conversation. And if I just use a quick analogy, most people, let's use something really simple, right? Men and women hold body fat generally in specific places based on physiological purposes. So men, we hold it around our organs, vital organs, bodily functions. Women, hips, buns, and thighs. Again, this is generalizations for childbearing purposes. But a lot of people are never told that. So you sit down with them, because guys always go, oh, it's just this bit here. It's always here. And women go, it's just here. And I say, yeah, but that's normal. And then when you explain and give them a why, they're like, no one's ever said that. So a very simple parallel, but I think and this is going to lead into the first question, understanding basic spine mechanics and movement. A lot of people are not told this, like you said, by professionals. So therefore that sets a really bad tone for a very unhealthy set of conversations, or as you said, it's personality dependent. Probably doesn't go the right way. So I guess to set the tone for the audience and really sort of, give us some definitions, Stu, could you run us through what you think are the most valuable explanations or basic spine mechanics? Because I think there's a lot of misconceptions which we're going to slay here, especially starting with that. And as in your book, I know you start with, demystifying a lot of the myths, but then also talking about the role of the spine, which most people can grasp. And then obviously it gets quite complex from there.
Okay, well, again, I assess the person to try and tap into their passions, what they understand readily and what they don't. And then that determines and what their concerns are. So if they said to me, I've got the diagnosis, I've got degenerative disc disease. Well, the word disease and the word degenerative has created a visual image in their brain that their spine is just going to degenerate and squish and collapse, which of course they don't have a disease and it's not degenerating. So I would then show them that the spine is a magical structure. Here we have a flexible rod, but not with ball and socket joints like a hip joint or a shoulder joint. These are collagen fibers that form a fabric. And if I wanted to delaminate a fabric like my shirt, I would create stress strain reversals back and forth. And everyone understands these concepts. They're very simple. And so the mobility part of the spine that allows us to dance, and depending on who I'm talking to, I'm going to have a little bit of fun. It allows us to procreate and have sex and tie our shoes and all, really have some fun and engage them. And then I say, however, you're telling me that when you pick up your child at 2 o'clock in the morning out of the crib, those are spine pain triggers. Well, if you allow your spine to get into a deviated position and it creates stress under those loads, if I can show you how the grand old women and the grand old men in the powerlifting world lift, they turn that flexible rod into a very stiff structure. So again, it's I'll come over to a bar and I'll say, if they are from Australia or England, I'll use a cricket example. You've seen the outfielder waiting on the cricket pitch like this. You know that position, do it for me. So I don't have to coach. There, they've done it. And then I'll say, all right, you're falling back on your ankles. Let's balance up your mass over your feet so you're hard to move. You can hold your ground. You can command a weight. You command your child as you're pulling it in across the baby's crib, leaning tower forward. Now, have you noticed that when you bend your spine like this, that triggers pain? Or it may be when they extend their spine, it triggers pain. But right away in that position, I can coach them now. That causes pain. That takes it away. Fabulous. Now let's turn that flexible, wonky willow branch into an oak trunk. So now I show them how to carry weight down their arms and then to stand up. Don't lift with the back, just simply carry weight down your arms, which now stiffens it into an oak trunk, and pull your hips through. Now, here I had a woman who was struggling to lift her child up for feeding out of the crib to now grip a bar, bend the bar, lock it in, and pull the hips through. And you would not believe the change in their psychology. For the first time, someone has taught them elite sport performance, weightlifting 101. And now they say, so if I get in that position, I organize the curve in my back, I gather my child, I hug him and pull my hips through. You mean, and I say, try it. So we'll put a sandbag on the patient exam table, which how many clinics do you go to with 1,000 pounds on a squat rack and a patient assessment table right in front of it?
I
But
love it.
anyway, you get my point. So right now, I've just taught them the rules of a linkage. So if it's a fella and he's a construction worker, I will say, well, you know the backhoe, you drive them. It's a tractor with a big arm that digs earth. Well, the backhoe operator knows it has a thumb, a wrist, an elbow, and a shoulder, and that's what the operators call them. But what do you have to do before you start digging? You put down the stabilizers behind the back tires into the ground, which locks down the tractor, because if they didn't, as they dug earth, they would pull the body around. So now I've just engaged them in a very high level discussion of laws of the linkage. So I might get a bodybuilder. I had an ex-Mr. Universe here last Thursday. So with back pain, it's the only reason anyone comes to see me. And well, no one had ever explained to him the concept of proximal stability. It's the law of the linkage. You cannot violate physics. Let's take our bench press muscle, which is our pec major. It originates on the rib cage, spans only one joint, the shoulder, and inserts or connects distally on the humerus. So when you activate that muscle, it causes the arm to flex. So if I wanted to push a door or I wanted to whack an opponent, I can use my bench press muscle. But here is the law of the linkage. Distally, that muscle creates the desired athleticism. It flexes my arm around. But proximally, on my rib cage, it bends my rib cage towards the joint. So if all I use is that big bench press muscle that I've developed, all I did was collapse myself. No athletic effect. But when we lock down proximally, like putting stabilizers into the ground on the backhoe, and I arrest the unwanted side of the movement, which is proximal, 100% of that muscle is now dedicated to producing the athleticism. Look out. So now they're pushing doors, and now I add a little bit of footwork. You've played basketball, do a drop step. Beautiful. Now pull and drop step at the same time, and we've just taken all the load out of the back and we've put it into their robust hip joint. So to teach people the physics of the body in a way that I've just done here, that's when they say, wow, thank you. And then I proved that that is transferable. We did a study on the Pensacola Fire Department, 75 men, and we created 3 training groups. One group was a control group. 25 men just trained with the trainers encouraging them to do more repetitions and that kind of thing. But the third group was what we called movement matters. And we coached them about basic patterns of squats, lifts, carries, pushes, pulls. We never taught them how to do fire ground activity. How do you chop a hole in a burning roof? How do you batter down a door? How do you pull a body out of a car wreck? But we measured them doing those fire ground tasks. Of the 2 experimental groups, the ones who just trained for fitness had even poorer movement patterns when they went out onto the fire ground, of falling into knee valgus, sagittal plane, spine deviations, etc. But the ones who we coached in the fundamental movement patterns in the way that I'm describing, then went out and worked on the fire ground with much less known injury markers. They were controlling knee valgus, they knew how to set the hips and all of this. So my point is, I think a lot of people don't understand the transference between the clinic and the gym and real life. Now, they may be overloading themselves in the gym, or they may just be all day long, not realizing it, building cumulative trauma or stress. They don't have chronic back pain. What they have is mini acute insults all day long that keeps them angry. Change those stress patterns by the way that they move, and the pain now winds down, and then you have them. They realize, I don't have chronic back pain. In fact, I am in absolute control. So those are some of the revelations that people get through understanding where the potential lies. And every single person has a different reason why they have pain. But we can talk about some of those things. But maybe that's just a little bit, or I might get someone who is not average. Now, if you look at me, I'm very short in the body, very long in the leg. I wouldn't recommend a front squat for a guy with my kind of proportions. Far too much knee load. My knee goes way, way ahead of my foot, but I've got good hips. So back squat, moving back into it, keeping my mass over my feet. It's hips for me. So, when you can go through those kinds of analyses with them as well, they realize that, well, here's a good one. I might use breeds of a dog, and I'll say, could you, they say, oh, I really want to play golf, and my buddies play golf, and I say, but this is your pain trigger, and here's the reason why. You've been training deadlifts to be a power lifter. You need to be an elastic athlete to be a golfer, so you've detuned yourself away from that. And also, can you train a St. Bernard to win at the Greyhound track?
Exactly. No.
No, it's not possible. You'll break the dog. And I see some people attempting to do things that if they just chose a different passion, they would be so much healthier. But anyway, there's just a little bit on some of the myths, I suppose. We covered quite a few there, that there's no such thing as nonspecific back pain. And most of the time when they say, I have pain there, it's not in their head. The pain is what the patient says it is. And if you chase it down, you will find the mechanism. And as I used to say to my students, if you can't find their pain, you made a mistake. Go back and reassess and you'll find it.
100%. A lot of what you said, music to my ears. And I'll just reiterate as well for the listeners, if you are listening, go to YouTube and watch this, because Stu did some visual examples there as well, which I think are well worth watching. And it kind of highlights, you made there was a couple of key words that stood out for me. Fundamentals is one of them. And after over a decade of coaching people, something that still excites me is when you go back and, you explain things in such a way where a lot of people are focused on the surface level. And we go back and I said, look, when we're in the gym, these movements, they all fall under a category. So it might be a hip hinge, a squat variation, a vertical push and pull. And as you said with the fireman example, you teach people the fundamentals, or you get the big rocks in the right places, all the pebbles fall favorably to a degree. And I often find that one of my main areas of expertise is skill acquisition and technique. That's one of the things I'm renowned for. People always go, how did Alex get someone from here to here? It's like, well, I explained it in such a way that no one had before. I took a complex concept like you do, and I made it very simple. And I went through all of these basic mechanics. No one talks about the base of support. I use pyramids. I'm like, hang on. I'm like, stand on one foot and try and do this. You use the example in your book of a dumbbell and the load it produces as it moves further away from the body. I use these analogies. You use stories, you use metaphors, you make it fun, which I know you do. And people grasp onto that. And, different people, different personalities, different examples. And people are just blown away by, wow, all of these aches and pains, they're gone. But like you said, it was by addressing multiple things, which they didn't have chronic back pain, perhaps. It was just movement patterns throughout the day in the gym that were impinging or causing inflammation or making them angry to the point where we just needed to remove or change. And one of the best examples I use, I say to people when I'm having a consultation, I said, look, I don't want to put technique on a pedestal, but just answer me this. When you go to the gym, how many people look the way they want to, if you would perceive it, or actually look like they train? And you go, oh, not many. I said, right. But they're doing the exercises, right? They're doing the lat pull downs. They're doing the squats. They're having a go. Yeah. So what's the difference between me and someone else? And let's not talk about genetics or nutrition or rest. I'm like, you can move load inefficiently. But if you learn to position joints, you know how to activate muscles. Again, you start building the core, you understand the role of them at a simple level. They don't have to be biomechanics, but it just changes the game. And people come in and they have so much more fun. And it's like someone puts a different lens in front of their eyes. And now it's, wow, I'll never look at this the same again. And the return on investment is huge. So yeah, I think there's some really critical points there. And a lot of people can kind of maybe now start to connect the dots in many ways. But to transition into more misconceptions, you know, we talked about a few there. What are some of the other biggest myths and misconceptions about the spine, but even back pain, that are most commonly occurring in the clinic and the people you work with?
Right. I'm just going to go back to what you were talking about for just a minute here. There are some experts who say movement doesn't matter, posture doesn't matter, and contribute to back pain, which you and we can't fathom this. And I wonder why. And then I realize when they come here or I go to their facility, they're not physical people. I will say, good, let's go to jiu-jitsu class. Now, you know, jiu-jitsu is all about joint position. It's not about strength. If you go to Gracie Jiu-Jitsu, in any Gracie Jiu-Jitsu gym you like, if someone is using a lot of strength, you just abandon that approach. Your opponent is guarding against it. So you find the new way, but they're boa constrictors. And then these deniers that posture is so important, just to have a few little jiu-jitsu lessons shows them immediately that they're crying like a baby, ready to submit with hardly any force at all. And then they start to realize that these people in pain, quite often, unbeknownst to them, are doing jiu-jitsu on their own body all day long because of the way that they move. So that was interesting when you were saying that, because that's not as easy a sell with some experts and patients alike. But getting back to the bigger misconceptions, the number of people that will get here. See, no one has fresh back pain and they say, oh, well, we'll go off and see McGill or one of the McGill clinicians. They go and see their physical therapist or their chiropractor or osteopath or family doc, whatever they're going to see. And if they get better, that's fabulous. I'm so happy. It worked for them. But what we get are the people who've been to 10 different clinicians. They've never gotten better. And in fact, they might now be even worse. And now someone says to them, nothing works for you. You've tried physio, chiro, etc. The last thing that you have as an option is surgery. Now, why does surgery work? Quite often, it's forced rest. So let's take an example of a subcategory of back pain personality that I will say they are an addict, and their addiction is exercise. So you see it right away. Say, I go to the gym every day. I ride the elliptical for 30 minutes. I have to. It relieves my stress. And if I don't do that, I will get so stressed, I'll come home and murder my kids. And I'll say, yes, but we just examined you and the movements back and forth, you're so wonky in the core that all those hip movements are now translating right to your spine. And if you do this with your spine, if I did this all day for 30 minutes, I will have a sore back as well. So I need you to stop. Oh, I have to ride the elliptical. I say, okay, well, go and have your surgery then. Now, but let's play a game. If you had surgery this afternoon, are you going to ride the elliptical tomorrow? No. How long will it be before you get back to the elliptical? 8 weeks, 12 weeks, something like that. And I'll say, good. I'm going to give you something that may be even more effective. It's called virtual surgery. And now I play a game. I'm very dramatic. I pretend I'm knighting them like in King Arthur's court. Tap them on the shoulder. There's your surgery. Now behave like a post-surgical patient, and we will wind your pain down. Tomorrow, you're going to have a couple of easy walks. You'll get up, go for a pee, very, very simple stuff. Then we're going to start developing some strategic mobility in your hips and shoulders, strategic stability in your core, and whatever else needs to be done, slowly re-expose you back and create a pattern of adaptation that builds some robustness for your life. And do you know, Alex, at the university, we followed up with every patient that we ever saw, every single one of them. I know exactly what they came in with. I know exactly what the assessment shows. We know whether they complied or not, because some people never did comply. And in a 2-year follow-up, if you fit the subcategory that you were told surgery is your last option, 95% of them, 19 out of 20, 95% said they were so glad that they never had the surgery, even after 2 years. So that's a very powerful statistic. And that opens up a lot of people's eyes. So there's another myth, I suppose. And you said earlier that some people might not do the exercise. Well, fair enough. But then I'll say to them, then you're wasting your time with me. I'll play hardball with them a little bit. And there you go. It's your choice.
Yeah.
But I never tell people this is what I say here. I empower them with some knowledge and then show them the way. Now, if they don't want to follow the way, and if they think surgery is the easy way out, I've given them what they need to make a sound decision. The decision is theirs.
And this is it. You can't tell people. I think the key is there, again, empowering. I'm on the same page. Absolutely. And that comes with time and credibility, because like you said, you have to sometimes be quite firm with people, and you can go, well, there's a reason why I'm here doing what I'm doing. And, we help the people we help. But ultimately, you might just need to say, hey, look, if you're after you've addressed a couple of the other questions that I wanted to touch on as well, which was obviously silver bullets in terms of there's no magic fix. There's never one thing to solve anything. It's usually a multitude of things. And again, back surgery. And it really saddens me because, reading through your book, The Back Mechanic, I'm sure we'll touch base on, and I'll put some links to that in the show notes for people who are serious about understanding this. But one of the misconceptions, or when you were going through, I could not believe that there were surgeons who were recommending to take people's feet off, to chop their feet off because of back pain. I know a couple of people who have had back pain. They struggle. They're in agony. And now, because I'm aware, and I've still got a lot to learn, but reading your book and understanding the knowledge, and then, I look back on when I was studying and learning anatomy and physiology, and I always say to clients and friends, I said, look, it's funny, I said, because that means more now than it did back then, because I've had years to apply it. Although at the time we were doing, like, you've got in the background a gym there, we were applying the knowledge. It was a great, institution in New Zealand. We were mixing the practical with the theory. But now working with real people in the real world, it all kind of makes sense and solidifies. And it's just such a shame how people still go, oh no, but my surgeon said, or this doctor said, and the virtual surgery is a beautiful example of, look, do this first, because the surgery is so intrusive. And most of the time, again, it's not going to solve the issue. It's the forced rest that will. And that could have been done without going into the spine. And a lot of the people I know who've had the back pain or who've had the surgery, they are chronically in agony. And that's really upsetting. I don't know if you want to speak to that a little bit more before we transition to a couple of other areas.
Well, this certainly would be regional differences. There are some locations where a person has pain and they are encouraged into surgery far too quickly. There are groups on the internet, they'll say, send us your MRIs and we'll tell you if you're a surgery candidate or not. And that, to me, I never even look at a person's MRI image until I've assessed them. And then, you look at an MRI. An MRI is a photograph, basically, of their insides. Now, you can look at my face, I can look at yours. We have scars and wounds of 20 years ago. They don't cause pain now, but they caused a bit of blood and pain at the time. But look at the picture. You see all the wounds, and then if I had a fresh scar, you see all the old scars. But if I had a fresh wound, you would see that, and touch it. Yeah, that causes pain. So this is what the MRI does. It shows the person's whole history of their life. How do you know that the features on the MRI are fresh wounds and the current cause of their back pain, or old scars, that all the pain is burned out? So they don't have a degenerating spine. They might have a changing and an aging spine. So this is the problem with looking at an MRI and saying, oh, there is something that we can cut the pain out. This, to me, just doesn't make sense, and I can prove it. Always assess the person, know what their pain triggers are, and then the MRI can be incredibly helpful. Yesterday, we had a woman who, I don't know if you know what the slump test is, but they sit in a chair and they round their back down, and if that causes pain, they say, okay, well, forward flexion causes your pain. But so interesting, she passes the slump test, but when she drives her car, she has excruciating pain. Now, what is going on? She sits slumped in her car, but the car driving extends her knee and it puts her foot on the accelerator pedal and the brake pedal into dorsiflexion. Now you're pulling the nerve root away from the head towards the feet. And I said, you're actually showing the opposite of a slump test. There is something along your rope of your spinal cord and your nerve roots that when it gets pulled one way, you get this excruciating pain. And then I followed her spinal cord and the fifth lumbar root, because the excruciating pain went to her big toe. So that's the fifth root. And I had a suspicion, and I found it. There was a Tarloff cyst on that root holding the root down. So no one had ever found this, and I wouldn't have found it without the MRI either. But it was the assessment that told me to go and look for that very, very specifically. So for the first time now, I cannot deal with a Tarloff cyst. I think we've tried nerve flossing them, and I think in my whole career, we've only had success getting a Tarloff cyst to desensitize through flossing. So that is a time for surgery. So I'm answering two questions now. When is an MRI helpful? Only when you have the context to understand it. And when is surgery really recommended? Surgery is recommended when you know the knife will cut the pain out. You're going for a single target. But when a surgeon says, oh, we're going to fuse 2 levels of your spine, and this is playing Russian roulette.
Just a quick one, guys, before we carry on with the podcast. For any of you who are interested in taking your health and physique to the next level, and you want to remove the guesswork, you're not quite getting the progress that you want, you're not seeing what you want to see in the mirror, and you're not feeling like you're really moving in the right direction, then click the link in the bio below, the apply button, where you can contact me. We can organize a free consultation, no obligation, and discover whether it's a good fit as coach and client. All right, back to it.
So there's certainly a time and a place for surgery. There's no question. But I I think in certain regions, people have back pain. And my rule of thumb for patients is don't consider surgery for back pain. You won't be happy statistically. Now, radiating symptoms and unrelenting pain and whatnot, these are different things, or if they've been heavily traumatized and tissues are really disrupted. But I have a whole chapter in Biomechanics, as you know, on critical questions that you should be asking the surgeon to determine the risk that you're going to take, because it's irreversible.
Correct. And I think the old maxim, just because you've got a hammer doesn't mean everything's a nail, rings true there, meaning we have tools as professionals and there is a right time and a right place, but ultimately I speak a lot to some like-minded professionals, one of which whom follows your work, and he actually recommended you. His name's Dr. Matthew Davidson. He works here at Hope Island Chiropractics, and I call him the magician because he's an amalgamation of professionals. And I remember I was seeing him at the time, and I walked in and I said, do you know who Stu is? And I held up the book, and he just looked at his bookshelf and he pulled out the Biomechanics and he went, just get it. This guy's brilliant, right? And he talked about assessments as well. And like yourself, a lot of practitioners are not seeking to understand, for lack of better terms, before they go in and start probing, recommending, diagnosing. They're not listening sometimes to the person who comes through the door. They're not observing. And I know you've written this in your book, where you will say you will see a patient walk down the hallway and you can almost, again, this comes with time and experience, start to hone in on perhaps what's going on just based on observation. But I feel, obviously we need time and experience. A lot of practitioners are going in blind, or they're not really paying attention, and they're just wanting to try and match something up with a technique or a diagnosis, rather than going, hang on, we have these assessments for a reason. Let's run them, because we might avoid, or as you used an example before, be able to find something that's more specific to where you can go, look, this is now a time and a place for this intervention, rather than feeling around in the dark and going, well, it could be this. Yeah, it's general with all of that. So yeah, there's some phenomenal takeaways there. I wanted to ask quickly.
Do you want a quick comment on that, Alex?
Yeah, no, please do speak to that.
I think there's a political context and a cultural context to what you just described. Clinicians perform procedures that they're trained in and they can bill for. So there are billing codes associated with each profession. Name for me the profession where there's a billing code for a thorough back pain assessment. They don't exist. So you will not get a 1 hour thorough back pain assessment. You will get an assessment if you're going to a neurologist, where they might do a couple of muscle tests and maybe some nerve tension tests. You'll go to someone else and they'll give you a range of motion test, whether or not that has anything to do with your pain. So my point is, they do what they're trained in. But let's go back to your chiropractor example, who's a little bit he's trained in anatomy, neurology, mechanics, psychology. In other words, can you imagine taking your car to a car mechanic, and the car mechanic doesn't know anything about suspension or transmissions or lubrications or computers in the ECU of the the control module, ECM, pardon me, the wrong ECU, ECM control module, etc. Yeah. All they know is an engine. So you say, well, my car's not running right. And he'll go say, yeah, right. Well, I'll change the engine. That's what happens in the medical field. Yeah. Versus the car mechanic who says, I'm going to run a test. And I may have to do another test till we hone in on what the specific trouble is that's leading to this plethora of problems with your car. So it's a difficult challenge to find clinicians who are trained broadly enough that they understand and have skills in all of these things, and that's why we had to train our own clinicians, actually. So if you go to our website, backfitpro.com, you'll see the various clinicians who we have certified in that they've passed the exams, they know all of these different foundational disciplines, and they have skills to wind down the cause of pain and build them back up again. And I'm going to say one more thing, if you'll indulge me.
For sure.
Cells communicate with one another through the language of force, pressure, position, posture. In other words, very fundamental physical signals. You can adapt tissues in your body through mechanostimulating the right force, the right position, the right pressure, etc. You name a system or a disease in the body that isn't affected by good movement. Not too much, not too little, just the right perfect amount. Every single body system requires good movement. Your cardiovascular, easy to understand that. Musculoskeletal, easy to understand that. Your hormonal system, your psychological system, every system depends on good movement. Now, let's look at the spectrum of healthcare. What profession owns movement? If you have diabetes and you go to your family doc, what's the chance that that family doc will say, I need you to exercise more with this specific dosage, this number of times a day, et cetera, et cetera? That's the most powerful modulator for an even blood sugar throughout the day. Or will they give you a insulin modulating pill? We know what the answer is going to be there. So they didn't give you the most powerful intervention for blood sugar. Anyway, I'm going to ask again, what profession owns movement in the full spectrum of healthcare, meaning the most powerful potential to affect that person's lifelong health?
I'm going to go with strength and conditioning coaches.
Bingo, bingo, the trainer. The trainer has the biggest potential to affect a person's lifetime health. That should hit every listener on the side of the head with a 2x4. That should be monumental. And when you get that right, the right dose of the right exercise for the right situation, it's powerful, very powerful. So that was a point that I wanted to make. And choose your strength and conditioning coach very wisely, because you see where I'm sitting here in BackFit Pro HQ. More than half of the patients that come here have been caused by trainers. Now, that's not an indictment of trainers. That is to say that if your trainer beats you up and makes you sore, and you think that's the reason for going to a trainer, I will submit that you will have a shorter lifespan of good pain-free health. But if your trainer gives you more than they take away, and you truly feel energized, more mentally in command, moving with less stress, that's the trainer who you want to pay well more than any other sector in the healthcare profession. Anyway, there's something that I have to get off my chest, and it's so important.
I love that. What a testimonial for great trainers. And that really is at the zenith of what I do. And that's what I'm passionate about. That's why we're having this conversation. I'm trying to create an awareness and raise the industry standard. Of course, there's always more to learn, but ultimately the standard for movement, for trainers, especially here in Australia, it's ironic. We've got some of the best strength and conditioning coaches in the world. It's a place where everyone wants to be fit. You know, it's a very hot climate. It's a very athletic-based continent, as you know, country. But there's also a big saturated market, but it's saturated with very low quality because of the governing bodies who are pumping out trainers in 12 weeks, and they're not giving them the tools to be able to transition into the real world and affect people with positivity. I use a great example to back up what you just said. When people come and sit in front of me, I say, look, I'm not going to smash you. No. And they're like, what? I'm going to educate you. The first, month, I'm going to just teach you how to move properly. And people come in and they're like, what? And they come in and, again, it's all of the things we've been talking about. It's base of support, it's positioning joints, keeping the rib cage over the hips, building core stability, learning what the muscles actually do. People are sat there going, oh my God, this is, and I said, look, I'm not trying to add value that isn't there, but you don't know what you don't know. And unfortunately, this is not taught. If you're a pilot, you don't just get in a plane and start pressing buttons. There's a very rigorous process. And I'm not trying to say that being a strength and conditioning coach is like a pilot. However, it is a skill. It is a profession that's not taken seriously enough because, as you just said, it's one of the most powerful tools for anti-aging. And even the neuroscientists will tell you that. Again, we talk about stress. Too much stress, we injure the body. Not enough, it doesn't change. But again, we have to set ourselves up to be able to cause stress by these movement patterns. And this is this massive gray area, which I'm always banging on about. And you said this before. And I often say it isn't sexy. You can't sell it, and no one's generally teaching it. There are people who are, but it's lost in the media. It's lost in all of the nice shiny magazines, and people just want to get in and smash it. And I said, look, like the barbell behind you, I'm like, this has to be earned. Again, I don't want to put it on a pedestal, but throwing someone under a barbell back squat, I can work with clients for up to 12 months before that's even an option. But even then, it doesn't have to be, because as you've talked about, there's different squat variations. Some people are not biomechanically built to do a front squat. Well, do we have to do a front squat? No. We could do a hack squat. We could do a goblet squat. We could do a box squat. There's so many tools available. But again, this is not getting taught. So with the coaches I'm able to coach now to cause more positive change, we start with these fundamentals, because if that foundation is not set, then everything else is going to crumble. And again, like you've already said, it's one of the most powerful tools to be able to affect someone in a positive or a negative way. And most people, when we fix and focus on technique and skill acquisition, basics, how to position joints, all the things we've been talking about in this podcast, all of a sudden, all the aches and pains are gone. I'm actually getting results. I feel more. Well, isn't that funny? Fantastic stuff. I love what you said. That was phenomenal. I don't know if you want to speak to that before I move on to the next question.
I think you've said everything that needed to be said.
Now, you talk about the big three a lot in the back mechanic. People are like, what's the big three? Squat, bench, and dead. I'm like, not quite. That's the powerlifting realm. I would like you to possibly speak to that and explain, if you can, what the big three are in your words, and why, when we talk about spine hygiene, and I use the parallel when I'm explaining this to people like dental hygiene. And I said, look, it's not magic, but a good dentist will tell you, hey, it's a good idea to clean your teeth once a day, to floss, to do X, Y, and Z. And again, it's not about cure. Often it's about prevention. So I use that parallel where I say, look, they're not magic, but these are things that you can do on a daily basis to prevent, but aid, rehabilitate, and perhaps strengthen, as we talk about the core muscles, to aid in back or spinal hygiene. So I'd love for you to, again, and hopefully I've got that right, but talk to that a little bit, please, Stu.
I'm going to go one level higher to set the stage. And in order to do that, we've been 100% dedicated to trying to increase our mastery in dealing with back pain to people for 35 years. And over that time, I think we have converged on the necessary attributes in the most efficient way to address this back pain issue. So yes, it must start with an assessment, but then every single patient, even though their assessment says they need different things, the categories of those things are the same. First of all, every single back pain patient needs to understand the cause of their pain and the safe position or the safe task or a safe place where they can go when they get the back pain and they're just fed up of it. What can they do? We call it the position of respite. So everybody gets a position of respite suited to their mechanism. Then we show them spine hygiene. And if we listen to their story and they said, the last time I threw my back out was when I sneezed. And I said, has any of your previous clinicians shown you why when you told them that? And they say, no, they just ignore it. And then I'll say, well, our assessment showed you have a dynamic disc bulge, and that is the cause of your pain. And by the way, if you flex down and sneeze down and give a load, a compressive load down through your back as you sneeze, that's exactly the mechanism that causes that. So now I'm going to give you a spine hygiene approach, or what we call a simple movement hack. This will seem odd to you, but next time you sneeze, I want you to lift your chest up and sneeze upwards. And I guarantee you that you won't get pain. And they try it and they'll say, yes, it felt odd, but now my psychology has changed. Before, I was victimized by having a sneeze. I feared it. It was terrible. I had movement fear and fear of sneezing, but now the fear is gone. I know how to control it. Fabulous. So spine hygiene, if we find out they sit and slump in a chair and that causes their pain, then I watch them tie their shoe and they sit in the chair and bend down and tie their shoe, and then they slowly work their way back to upright standing. They've offended the trigger, they've tenderized it yet again, and they just were a victim. And I said, all right, and we're going to show them a lunge. Put your foot, instead of sitting on the chair, put your foot up on the chair in a lunge position. Now take your hips down towards your ankle. Let your knee go forward over your foot and bend your back leg. Take your hips down to the target. Stay tall, be chest proud, be a peacock, tie your shoe. Oh, doc, you're magical. It didn't cause me back pain. You are now empowered and psychologically strengthened. It's interesting, Alex, when you look at the clinical psychology books and you look at the clinical psychological posture consistent with mental depression, the knees are pulled together, they sit in flexion with their hands folded on their lap. This is clinical depression, but it's also stress on the discs. When we show them, I don't want you to show me how depressed you are. Stand up, own the world, sniff a little air. Not only is that a psychological reset, but now I've just de-stressed their pain. So these are, again, am I talking psychology? Am I talking biomechanics? Am I talking neurology? It's all of those things, forming movement hacks. So this is spine hygiene. How do you get on and off the toilet, brush your teeth, in and out of your car, have sex, do whatever. By the way, we did the first study on that to guide. If you're a frontline clinician, or how many of your clients over your 30 years have come to you and said, you know, I knackered my back with my husband or my wife 3 months ago. We're now celibate. We're deathly afraid of sex. Do you have any hints for us? Do you know there's no clinical guidelines that existed before we did that study and then put together an atlas that if you are flexion triggered, here is a recommended position where you've now got confidence. If you are extension triggered, here is a suggestion for you. And that's in the last chapter of Back Mechanic. But anyway, you get the idea of we're really teaching jujitsu for life in the spine hygiene. Now, we live in a linkage, and I've talked about the fundamental mechanical properties of the flexible rod, the spine, and at sometimes it has to be stiffened to allow you to lift your child or a barbell or whatever the case may be. And there are other times where you need mobility, but there's no surprise that you have a ball and socket joint at either end of the spine, of the core, to transfer power from the core and across the ball and socket joints, because it's your arms and legs that propel you to throw, to kick, to run, to all of these things require this distal athleticism. In other words, you need proximal control and proximal stability. I'm assuming some of this will go to YouTube, so I'll just show you a little bit of a visual here. When someone damages a knee ligament, the doctor will do a drawer test on the knee and measure the laxity. In other words, damage or injury causes laxity to a joint. It's also shouldn't come as a surprise that if I want to do an arm bar to an opponent, in other words, compromise them, so either their shoulder tears or they give up and say that's enough, you traction the joint and lock it in end range. This is jiu-jitsu. So there is a spine, and this joint has been damaged. L4 disc has been damaged. L3 is normal and L5 is normal. They have normal stiffness. But watch this joint right here. I'm now going to twist. Do you see how the majority of the motion is now taking place at the damaged joint? Those are micro movements. So we measure those micro movements in the spine. You can't see them on MRI or X-ray or anything like that. Only a physical exam will reveal why that person moves a certain way and they have a catch. It takes their breath away. For the first time, they're understanding the micro movements that are occurring at a specific joint. If that was you, I might say, humor me, push your fingers into your lateral oblique muscles, lateral to your navel, push your fingers in hard. Now push your fingers out, bang. Now repeat that movement that caused you pain before with a mild sense of control. And the patient might say, oh, I don't have those shots of pain anymore. I've arrested the micro movements. And the pain patterns from micro movements are continually changing. The person will say, well, you know, when I first get out of bed and I've been laying on my left side, the pain is in my right side of my back. But then I do something else and now it's going into my left buttock. In other words, they've got micro movements. So core stability now is responsible for engineering out or stiffening out the micro movements. So now I've given you 3 reasons why core stability is non-negotiable. It arrests micro movements. It allows this rod to stiffen to bear load. And the first one was proximal stability to unleash distal athleticism. Now, we did many, many experiments looking for what is the best way to create sufficient stability for those 3 reasons. The big 3 kept bubbling up to the top. So I didn't invent those exercises. All we did was quantify them. We measured stability. They were the most efficient way to create core stability with the minimum of compression penalty on the spine. So when you activate a muscle, it squeezes the joint. But these people have back pain. You don't want to squeeze the spine and the joints, so you have to be very strategic and find an efficient way to create the core stability and arrest the other mechanisms of their pain. So that's where the genesis of the big 3 came from. For the back, it's the bird dog. It's not a bending exercise. It's actually what a structural engineer or a mechanical engineer would call a 3-point bend. Whereas if I bent over and did a row, that's a cantilevered load. It creates shear on the spine. But a bird dog, no shear. A side plank, once again, a 3-point bend with no shear on the spine, very tolerable. And then a modified curl up, where we control a lordotic curve to minimize the stress on the discs, allow it to wind down pain, and don't lift very high. Just hover the head, the shoulders, and the top of the rib cage off the ground just a little bit. And then we progress those into things like dead bugs to bring in hip flexion and all the rest of it. But that is the basis of creating a linkage that moves well. Now go to different sports. I know there are Aussie rules football clubs in Australia because I've consulted with them, and they start their training programs with the big 3. Why? They run and cut a little bit faster. The fastest man in the world, go look at Usain Bolt. How does he train? bird dogs, side planks, builds a core of iron to get more of the gluteal hip power, not bending his spine, but propelling his femur. There are NFL football clubs that start their weight training sessions and their on-field sessions as well with the big three. So there are many reasons for, well, we'll just say that they're non-negotiable. So there's a little bit of a discussion about the big three, and I'm sorry, I think that was a bit long-winded.
Not at all. Not at all. This is long form content podcast. Speak freely. It's great. You know, people, it's super intriguing. And it reminds me of a story too. You know, we use the analogy, say you buy a car, right? You buy a Toyota, and let's just say it's a Camry or whatever it is. And now you notice the Camry, right? Because now you've got the car, so you're aware of it. So since reading your book and learning more and ever evolving things, I'm in the gym. And even my clients will say to me, oh, Alex, I notice how everyone, they're not positioning joints. And I said, yeah, so it's interesting. And we're not having a go at people and we want to help people, but they're aware of it now. You know, when they see that, they're like, oh, actually, now everyone does the techniques. I'm like, yeah, because now you're aware, but before you were oblivious. And I see people just doing these ab exercises, just wow. And I cringe. And it takes me back to New Zealand. I was talking about where I studied. And in New Zealand, I was fortunate enough to train at a facility called Wintec. Now, in New Zealand, it's a small country, as you know, you said before, it's like Canada shrunk down before we went in. And you mix with, you know, an eclectic sort of bunch. And we were surrounded by Olympic athletes. And I remember I was in the gym one day, which was similar to yours. It was like a little facility off the classrooms where we could go in. And you know, I was always very lean, but when I was young, not very muscular, but very lean. And I remember speaking to, there was a couple of gentlemen in there, and I said, hey guys, have you got any really good ab exercises for me? Because, you know, I want to build more abs. And they were like, and I had like, you know, the rectus abdominis, the six-pack abs, very ripped. And they went, well, you've got good abs. Little did I know these were Olympic athletes at the time. And they said, but have you got good core stability? And I went, what's that? Because I was new to it. And I said, yeah, abs, look. And I showed them my abs and they went, okay, let's do a prone hold bridge. And they showed me how to do this bridge. And this wasn't even a side plank. This was just the normal. And I was shaking and I couldn't even hold it for 30 seconds. And they went, look, you may have good aesthetics, but for performance and even health, you want to work on this core stability. That was the baptism of fire. I didn't understand any of this back then. I was new, I was fresh. And that back then was like, wow, that was an epiphany moment, because I looked aesthetically pleasing perhaps, but I didn't have the performance. I didn't have any core stability. Even if we're looking at not for performance, we're just looking at general spinal health and functionality. And this is the misconception that a lot of people have. They're swinging around, they're doing all these, you know, leg raises, and I see the spine going in all different positions. There's no stability. They've got chronic back pain, or you see them on the GHD machine. And I just, where I can, helping people in a, you know, professional way without offending them, say, hey, have you maybe thought about this, and explaining. But people train abs like it's going out of fashion. And nowadays I say to people, look, I don't even technically isolate the abs. I do more core stability, but I'm using them throughout other movement patterns. So again, building the foundation, we get this, but trying to go up to the top before building the foundation is, you know, nonsensical. And when we learn the role of the core muscles and we explain that, people start to go, wow, this is maybe one of the things that's contributing. And I said, yeah, you know, you're pissing it off every time you're swinging up on a bar. You're using more of your back than you're using more of your abdominals. But again, people don't know what they don't know. But again, if you want to speak to that before we move on.
Well, it takes my mind to two different studies. I don't know when I'm a professor doing a study, or when I'm a coach, or when I'm an educator, or when I'm an athlete. It all just blends together. But I was asked, there was a country who was very good in international rowing, and they had a very high rate of back injury. So they asked me to come in and consult with them for a few years. And we learned a lot, but I got numbers of competent rowing without pain. And I've done this on many different athletes or athletic groups, and it's the ratio that's important as well, but it's a little bit sports specific. So you were talking about holding the side plank for 30 seconds or whatever. If you're an Olympic rower, I would like you to be able to hold that over a minute, but not more than 3. Now, isn't that interesting? 3 means you're abdominal dominant, and it's too much. Oh. So we developed ratios depending on different sports for optimal performance. So that's the first thing I'll say about the nuances of then training for performance. Then we took, one of my graduate students was a Muay Thai fighter. But he was also a mechanical engineer, and I used to say to him, "Are you sure you want to go in the cage and fight again and scramble your brains, because you're making more money as a bioengineer?" But anyway, he was passionate about it, and so his thesis was enhancing striking power in Muay Thai athletes, who they punch and they kick. So arm strikes, fist strikes, and leg strikes. And then we measured who kicks the hardest, who kicks the fastest, and then we trained them. And do you know the group that trained core stability, arresting all of those unwanted energy leaks in the core, so that when they fired off the trailing hip, the core didn't rotate away and full power went in to the strike. And then we trained isometric core stability, and it hardened up their punch. In other words, when you were hit by those boys, you were not getting hit by their fist. You were getting hit by their full body turned to granite at that instant. You'd rather be hit by that Toyota Camry that you were talking about earlier than to be hit by one of these fellas. But the velocity, we call it closing velocity in the fight game. So you're in guard, and then you unleash, you rotate, and then closing velocity of the fist to the target. That was enhanced by dynamic core stability exercises. So again, I talk about someone like Usain Bolt or whatever. It's a combination at that level of performance of both isometric core stability, which a lot of the bodybuilders fall down on, because it is repetitions through the range of motion and whatnot. But in certain sports, a little bit of both is needed. But anyway, I just thought that was what was going through my mind as you were giving those descriptions. But a lot of that data is contained in my Ultimate Back Fitness and Performance book, which is assuming the person, you've been successful at getting them out of pain, now it's time to return them to either their sport of that's how they earn their living, or it may simply be their passion in life.
And that's the next book that I'm due to purchase, because I was so blown away with the back mechanic and working with professionals and training at a higher end, and even working with professional elite athletes. Now I think it's just phenomenal, the investment, and really to understand it at that level, because you use some keywords there, nuance. It is nuanced, because now we're working not just for general back health, we're working for specific back spinal health, where we want, as you were saying there, specific outcomes. And depending on the outcomes and the movement patterns of the athlete, we're going to need to require different tools. So I'm really looking forward to delve into that one. But before I get into, so I have a series of rapid fire questions before my final question. These are a bit fun in nature, Stu. They're lighthearted. But before we do, I remember a point I wanted to talk about before, and it's up to you how long we want to spend on this. But are you aware of a fella called Dr. Joe Dispenza?
No.
So he is he's a well-known figure he has a multitude of qualifications, but ultimately he's dedicated his life on psychology to help people repair themselves. So he was a chiropractor by trade, if I'm remembering correctly. So chiro, it wasn't a physio. And anyway, he was in a triathlon. He was a very active gentleman. He got knocked off his bike to the point where he was on the side of the road, and he was lying in a bed, and he was faced with, we need to do herringbone herring bone rod surgery, whatever it was. And he was like, look, I really don't want to have surgery, and he was consulting his friends, and the surgeons were like, look, if you were my son, you'd already be on the table. And they were saying, look, you'll never walk again, all of this, right? And this is his sort of well-known story, and you can have a little Google and you'll find it. He opted not to do surgery, and he just believed, understanding what he knew about, physiology and biomechanics. He was like, no, this doesn't make sense. I think I can rehabilitate myself with my mind, and again, using activities and finding a way to start with low stress and build it. Now, the spoiler alert, he's obviously now on stage and he works around the world, and he's helped a lot of people in a lot of different areas by controlling this, but also in relation to this. And he's a doctor now, because he said, look, if I recover, I'm going to dedicate my life to studying this, understanding it, and finding evidence which backs up why I walked out of that hospital a couple of months later, walking when I should never have walked again. So I was wondering if you'd heard of him and what your thoughts were. But if you've not, then perhaps that's something to have a little look at. But it pretty much just predicates a lot of the things that you talk about and that you help people with, but again, in a very pragmatic way. Like, it's not magic, but you talk about before, what is it? It's all of those things combined, and it really is. And the power of the mind is huge. And I think a lot of people, if they're closed off or they're unaware, like you said, we've got different personality types that we have to address. That can really set the tone for, how someone treats their back pain, their spinal health, but anything in life as well. But that was something I was curious to know.
Well, you've now entered an enormous area, and I will see on occasion, say in social media, McGill is just a biomechanist and he only considers mechanics, and I think, well, that person's never worked with us. I found that very odd, but I wouldn't consider myself an expert in the academic side of it, but I will be the first to say the mind is incredibly important. And in terms of the stimulation and creating a body that's ready to receive the adaptations, the psychology is incredibly important. I don't know why I'm going to say this, but I will. I don't know if this is off topic or not, but I've had certain challenges in my life when I was about to give up. And I might read, say, The Power of Positive Thinking by Norman Vincent Peale. I read a book. It's about setting your mind and what you think. And it was just a ton of bricks hitting me on the head, steeling me, toughening me, physically and mentally. And all right, I remember my father saying to me when I was a young fella, and I can't remember what the situation was, but he just said, "Are you a man or are you a mouse?" Well, that's psychology. What am I? Damn it, I'll do it. And it's incredibly powerful. And you see also the number of people who have such miserable lives because they don't go for it and they hold themselves down. Well, this is psychology. It's awful to see.
Yeah, it is, and it oftentimes
it's not a back related specific question at all, but we should be together in person, each with a beer and a bowl of peanuts or something like that. We'd have a wonderful conversation.
Yeah, well, absolutely, and that's what this is about. It's not always about a lot. Yeah, after doing this for some years now, I speak to people like, I'm not sure about what I'm going to say. I said, look, it's more about who you are as well as what you do, right? Because we have these job titles, but people forget we're humans. And a lot of the time, the stories that you have, and you just use a beautiful one there, like the memories that you have of your father and the psychology, it breathes life into what you do as a practitioner. And ultimately, from what I can ascertain, some of the, the best clinicians, and I say the best just based on the results of their personality, they're real people. They're real people that are really passionate about what they do because of their own personal experiences and journeys. And people are interested in that, because if you just talk, the theory all day, I mean, it's great, but if you can't communicate that, and, I can tell with your personality, you use metaphors, you make it fun, you're relatable. That's what people want. They don't want to sit down in front of a robot. They want to speak to a real human that shows empathy and care and understanding. And I think that you do that absolutely phenomenally. And I'd like to think I'm a good judge of character at this point where I can pick that up well. So
do you want to comment on that? We're getting way into the weeds now, but I did a podcast yesterday and I got into a discussion of what I am absolutely fascinated by. And I live in central Ontario in this little place. Here's BackFit Pro HQ, and people fly in from around the world. You will be amazed, Alex. I have seen royal family members from several royal families. I've seen prime ministers and presidents of countries, Hollywood elite, pretty much the richest man in the world. And it's so fascinating to me. Here was a fella who's made $1 million every day he's been on this planet from the day he was born. If you add up his wealth now, what makes him tick? How do you go to a king and I say, how would you like me to address you? I wouldn't have a clue. Or people might say, how do you talk to this superstar athlete? Another thing my father said to me, and my dad died quite young, so he had no idea that I had finished high school even, and this kind of thing. But he said, whoever you are with, treat them like you're equal. And that has served me so well to have these conversations that you're talking about. And pain strips everybody back to their fundamental humanness. And then you realize, man, we're all the same. We're all the same. Every single one of us is hurting inside a little bit somehow. And to get to some of these things and really unravel the pathway to help a person is something I just find so fascinating. But I've been so lucky on Saturday. I saw once again an elite superstar, and at his core, he was just like you and I. Same insecurities, same, and yet, I before I meet someone like that who I don't know, I'll go on YouTube and I'll watch a few clips of them playing, and then I'll see some stupid kid putting a disgraceful, dirty, derogatory comment afterwards. They've never met this person. They don't know where he came from and the challenges he faced and what he did to himself to get to the level that he's at. And it turns my stomach that some of these wonderful people have such ignorance and hatred. They don't deserve it. No one knows them. And anyway, I just thought I would throw that in, that's one of the joys of my life, to meet some of these people, and they are fabulous superstars in what they do, but they're just like you and I.
Yeah, no, it's a super valuable takeaway. And look, aside from all the other value that you've given in the podcast, if someone takes something away, and if it's that's phenomenal, because too many people put people on pedestals. I mean, my father had a saying as well, and he still does. He goes, Alex, he goes, everyone breathes, they go to the toilet, they eat. He goes, you know better or worse than anyone else. And it's the whole predication behind that is treat people as you want to be treated. If people are like, these comments, want to be keyboard warriors, well, leave them to it, walk away. But ultimately, like you said, we're all going through struggles. And when you break someone down, and if pain is the medium, and it often is, and you actually remind me of a tutor that I had by the name of Jim Patchett when I was at EMF, and he's a wonderful gentleman. He just such a people's person. And we had this high-tech facility, and right in the middle, he had this shed, and it was outdoor adventure. He had his ropes in there, his boats, his canoes. He had a similar image to you as well. And he always used to say, oh, you know, if you ever want 5 minutes, you just need to get, just come and have a, just we'll come and have a cup, or we'll talk about life. And I remember asking Jim, and I always tell people about Jim because he heavily impacted me in a positive way. And I said to Jim, you know, we're doing all this, you know, we got anatomy and physiology, we're doing biomechanics, you know, we're doing leadership, we're doing all this. And then you go to Jim and we're doing these team building activities and rock climbing and trust falls. And I said to him one day, I said, Jim, I said, you know, I like this. I said, but what's it got to do with being a sports scientist? And he said, Alex, he goes, this is the stuff that binds it all together. He goes, because when you get people in the corporate world, or from any, like yourself, you know, he works with high level professionals, elite athletes. He goes, when you get them doing this stuff, you find out who people really are. When you put them on the edge of a cliff, that's when the true side of people comes out. So he goes, this is understanding people and psychology. And again, it was building all of the cohesion and the communication skills, which put all of these things into practice. And if anything, it was probably the most valuable part of the course. And at the time, I just couldn't see it. I just thought it was a bit of fun. I didn't see the correlation. And going through those experiences myself, kind of to add on what you were saying, it really shows you that people are people, man. And we're all facing an internal battle no one knows anything about. And the pain and the discomfort really unveils and unsheaths people at their core. And it's a beautiful thing. And I think if more people could understand that, and this is why these conversations are valuable, I'm like, great, someone's got a job title, that's phenomenal, but you're still a human. People say, oh, how do you speak to these people now, Alex? How do you know, I said, well, they're just people. Like the mindset is they are like-minded people who are doing passionate things. They might be on a different journey. They might have a different culture. They might even speak different languages, whatever it might be, but they're human and we are one and the same. So I think that was a beautiful takeaway, Stu.
Terrific.
Now, to round out, I have a signature question, but before that, we're going to get into the weeds. This is, and I know you're going to like this because this is a bit fun, right? This makes it really human as well. And these are fun questions.
I'm warning you, I'm a very slow thinker. So if there's dead space, the computer hasn't lost its connection.
So there might be semi-rapid fire questions then, right?
All right, yeah. Slow them down for the old man now.
Look, whatever comes to mind. These are lighthearted in nature, and they get the juices flowing actually in the brain. So the first question is, and there's no rules here, Stu, so whatever you want. If you could choose a superpower and you can make it up, what would it be and why? And it's just whatever it is at this moment in time, because the more you marinate on that you'll start to pick different things.
Yeah, I couldn't even answer that because my brain would never even consider such a thing. But I can tell you this: when I work with an athlete, I will say to them, or even a recreational athlete, I'll say, I will do my best for your back, but tell me, what is the one athletic variable that would really propel you? And a lot of them will say, well, I need more hip extensor power. You know, if they're a martial artist, they'll give you a very eloquent expression of what I need more explosive power, whatever.
Yeah.
If you go to a basketball player, typically they'll say, I don't know, I just do it and it flows out of my body. As not to, I'm just giving you generalizations from sport. But if the person is absolutely clueless, I don't know, and they're an elite athlete, I say to them, you need a new coach. You don't know what you're training for.
Yeah.
So you have to know what variable, if you could train and enhance it, will make you a better performer. And that has to be in your training program. So I'm not answering your question because I don't think about myself that way. However, I would go through that exercise with a person to hone in the goal of their program for sure. But superpower is so abstract for my brain. I would never.
I think you've got a few though, don't you? Anyway, being able to help people.
Well, I don't know. But anyway, all right. Next question. I'm sorry I flunked that one.
You're all right. Hey, this is completely unique. There's, like I said, there's no right or wrong. This is all part of the fun. It's because it's good. It's unpredictable. This is what people want. It's organic. It's real. The next one is quite simple, but I have a passion for food, so this is why I like asking this question, and I'm interested, whether it's vague or in depth. But you know, my mum's Italian, my background's Italian. My favorite food is pasta and pizza. So I like to say to people, you know, if you had one last meal, or if you had a favorite meal that you love, and even what it is in this time, again, what does Stu sit down and eat? What's something that you really like to enjoy with yourself or with your family? Food.
Yeah, well, it certainly depends on my mood. At sometimes I would say my comfort food would be my grandmother's rabbit pie. So my granddad would go out and shoot a rabbit, and we would clean it, and she would put peas and carrots with a lot of gravy in a pie, and that's what I remember from my childhood. Now I love, like you, a lot of different foods, and I usually say, what's my favorite meal? Whatever is put in front of me.
Fair enough. To be grateful to have the food.
Most of the time, absolutely, yes.
And to transition then onto the last rapid fire question before the final or the final signature question is, if you could invite 3 people around the table, dead or alive, and this is going to change, so this is a difficult question, to eat some rabbit pie with, who would you invite to have conversations with? If you could pick anyone, and you've met some phenomenal people, so I know that's a hard question.
Can they be dead or alive?
Dead or alive, doesn't matter.
Okay, number 1, Muhammad Ali, no question.
Yeah.
Number 2, Bruce Lee. Number 3, Jesus.
There we go.
Yeah, I've been asked that question before, and I've actually given that thought. So, you know, if I said to you, who is the greatest? Most people would say Muhammad Ali. Well, that's incredible for a kid from, you know, Missouri, and to go through what he went through, and people around the world will probably know that answer. And Bruce Lee for, I have 2 libraries here. People think, oh, I've got this huge academic library. Well, I did actually in my office. And the day I retired from the university, I shut the door, walked away, and said to the graduate students, go take whatever you want. I just walked away from it all. I never brought those books home. So I have 2 libraries here. One is a collection of Muhammad Ali, and the other is a collection of Bruce Lee. And the writings that Bruce Lee did were absolutely phenomenal in terms of enhancing performance, training, nutrition, psychology. Incredible. And to think that he died so young, he was incredibly, the output of that fellow. And, you know, it's too bad. People saw him as the Green Hornet and in some of these movies, and that's what they think Bruce Lee was. But I think that we would have had fabulous conversations, training sessions, etc. So that's why that one. And Jesus, you know, people get inflated and deflated through oral histories. And I'd really like to see what he really was like about.
Yeah, very intriguing. It's a great eclectic mix. And as you said, it would be good to go back and speak to those people and get the truth and just see what they were actually all about.
My son is actually, so is my daughter, very, very spiritual. And he took himself to India as a young fella. He just said, "Oh, Dad, I'm going to go and visit India." And he went up to northern India, right? And he went into the temple with the Dalai Lama, and there was the Dalai Lama sitting there. And I said, "Well, he said, well, I didn't get to speak to him, but he spoke with some of the other monks and stayed there in that location for a couple of days." And so there was he said, "Well, I really want to go and do that and seek that experience." But he's done a few things like that as well to go and.
Yeah. I've heard it's I've had a few friends who visited in one of the most, if not the most spiritual places on the planet. It's very intriguing with the history, the culture, the Vedas, those scriptures
Yes.
that are written. Phenomenal stuff. My last question, Stu, is a bit more serious in nature, and it is quite poignant with the name of my business, Fearless Training. And it's, can you please identify a fear that you've had or you've still currently got that you're overcoming, or you've overcame, what it was and what you had learned or what you are learning from that fear? Because I think fear is such a powerful teacher.
Yeah, I've got many fears, actually. One of my biggest ones was the fear of being in public and public speaking and being on stage, which a lot of people will find strange. And obviously, COVID has changed all of this. But, I would be on stage with sometimes thousands of people in the audience. And I would come out occasionally and just stand there and look out there. And I said, "Forgive me, but my knees are shaking. And it's going to take me about 10 minutes before my voice stops being so shaky, because I've never been able to overcome this lack of confidence." Okay. Yeah, lack of confidence to get up in front of people. And for some reason, they're asking me to speak. And sometimes that puzzles me. I was in my PhD, halfway through, I was at an international biomechanics conference, and one of the keynote speakers was Harry Farfan. Harry Farfan wrote a book called Managing Low Back Pain. He was a spine surgeon, very well known, very well respected in the lumbar spine society, etc. But the interesting thing about Harry was he had this aura of supreme confidence, but he had a voice like James Earl Jones, the actor. So very deep, resonating voice, and you thought you were in the presence of God when you were with Harry Farfan. And he said to me, "Well, that was a very interesting lecture that you just gave." And he asked me a few more questions, and I said to him, "Dr. Farfan, I think I'm going to quit. I'm going to leave my PhD. I am physically sick before I have to give a speech or be in public." And he said, "Oh, that's interesting." He said, "Well, you just gave a great lecture." And he says, I'll tell you my perspective." He says, "As long as they keep on asking you to come back, just don't worry about it. They've asked you, and go and tell your story. But if they stop asking you, then your problem is solved." And it was just simply him saying that to me, that I still struggle to this day getting up. I was nervous before meeting you, and I had to sit down and collect my thoughts and try and face this not little challenge, but do you know what I mean? It's not something that I'm all of that comfortable with, and I never have been. So there's one fear. I hate going on my roof because I don't like heights. But anyway, that might be a surprising fear for a lot of people.
Yeah. No, I think a lot of people really resonate with that as well. I appreciate the honesty, and it is something that, it's always there. And sometimes it's good because it means that we care and we're passionate. And, we have this innate ability as humans to project or think about, oh, what are people going to think of me, or I'm going to say something stupid. And what has been really interesting to me through all the conversations I've had with, some of the best professionals in the world, like yourself, and you've met thousands of people, you've helped thousands of people, so much knowledge and wisdom. And yet a lot of people are still afraid to speak in front of multiple people or to meet new people. And I just find that absolutely fascinating. But then that just reinforces the point that we made before, which was so critical, that we're all human.
Yeah. I said to my wife a little while ago, I said, oh, please, I hope I die before you, because if you die before me, I will never, ever be able to go out on a date with someone else and have to meet someone new and go through all that over again. But
the dating world
crazy?
Is not what it used to be.
I watch my kids. Neither of them are married, and you're right. I get it. It's not something that would be familiar to me.
Yeah, no, 100%.
I'm a little old-fashioned when it comes to those sorts of things.
Yeah, which is not a bad thing. It's not a bad thing. Stu, before we give some links and some context to where people can find out more about you, if you could just leave the listeners with one thing that they could and should do daily, apart from the multitude of things we've talked about here today, that would improve their health and vitality, and it can be completely off topic from what we've talked about, what's the one thing that you'd offer or recommend that people do every day?
Well, people, it's a rainbow world. So in my world, I can't give something that fits the full spectrum of the rainbow. My world is looking at the individual and trying to give them a path. But to be general, you don't have to be super fit. In fact, if you are super fit, you will probably wear yourself out, and you won't be the best 80-year-old granddad playing with your grandchild. You will be too sore. So moderation, a couple of days a week, train some strength, a couple of days a week, train a little mobility. And by the way, when I was 30, I couldn't have given two hoots for mobility. I didn't need it, had plenty of it. Now I've got a few miles on my body, a little bit of an injury history. I need a bit of mobility. Yeah. Do a couple of weeks, do something for the old ticker, a little bit of cardiovascular work. And probably the wisest thing I can say is one day, don't do anything. Let that day be your day for adaptation and rest. And then, it contravenes so many of the kids in the social media world these days. Oh, on my day off, I just ran 5K. And I think, oh, you young child, if you only knew that day was the day you could have adapted, so you could have enjoyed the rest of the days more robustly. So there you go.
Yeah. No, and that's I think it's a really valuable way to round off what I can wholeheartedly say has been one of my favorite conversations to date, Stu. I've thoroughly enjoyed it, and I appreciate your time. I appreciate everything you do. I know the listeners and the watchers are going to really enjoy and derive a lot of value out of this one. For people who want to follow along with more of what you do, they might want to reach out, they want to find you. Where are the best resources, websites to be able to do so?
Right. Well, the website is backfitpro.com, and there's two portals of entry. So if you're a clinician, enter through the clinician door, and we have resources to assist those who help others. We also have descriptions of if they're interested in studying and being certified and that kind of thing. The other door is, are you a back pained person? Then that gives you a different set of resources, some of the books that you've talked about. All of the clinicians that we've trained, it gives their contact details so they can find a person who can give them our style of assessment and try and converge on an understanding of their pain mechanism. So that's pretty much it. backfitpro.com. We do have a Facebook page and a Instagram page, and I know we have a lot of followers. To be frank, I really am not in that world, but our people are, and my only rule for them is I don't want advertising. I don't want fluff. I give them content that will help people, or let them know about this podcast, for example, and that kind of thing. So I try and, I'm not going to argue with anybody. That's the way it is. So here's some information. If it helps you, wonderful. And if it isn't, I'm not going to argue about anybody. All my job is to try and create the resources, and it's up to the people if they want to consume them or not.
Wonderful. And
I just had a thought. When I was chairman of the department at the university, I was given one piece of advice by the fellow who started the department. And he said, yes, you do want to vote to go a certain way for a direction of the department or something like that. And he says, trust people. If you give people the right information, trust that they will make the right decision. And I've tried to live by that.
Absolutely. And I'll put all those links in the description below, in the YouTube, okay, in the podcast, for people who want to know more. And again, it's a beautifully eloquent way to round out what's been a very enjoyable conversation. Ladies and gentlemen, Dr. Stuart McGill, thank you for being so generous with your time. I really appreciate it. And for people who are watching and listening, I've got to say it, guys, this information Stu just said, pay it forward, give people the opportunity to at least listen or grasp this knowledge, and hopefully they can take something away. That's all we can do. Is we can always just present and empower, which has been a key theme in this podcast. So please make sure, if you're on YouTube, to be compelled to share with someone who you'll find it, or who will find it valuable. Subscribe for more. And of course, guys, you already know, until the next episode, stay fearless. For those of you who are confused, frustrated, and sick and tired of not seeing the results that you want or deserve, make sure that you click the Apply for Coaching button in the description below and line up a completely free consultation with myself, where we can discover if it's a good fit as client and coach, and take your health and physique to the next level once and for all.